Joining us now via Skype to discuss the rising cases of coronavirus is Dr. Okeke Awele, the Program Officer, Onkopadi, COVID-19 Response Unit. It's nice to have you join us on the program. Now, Dr. Awele, the issue there is, let's talk about the issue of awareness first, which certainly will, a lot of people say if there's enough awareness, it will go a long way. And it's part of what you have been providing. How much of awareness do people have, and how much are you providing from your end?
Okay, it's nice to be here. I think with the ongoing pandemic, a lot of notable organizations have come or have risen up to the challenge to provide adequate awareness to people. We have multiple organizations like WHO and other organizations like that, making sure to update people on the ongoing situations around the world, telling them about precautionary measures to take. And also here at Onkopadi, we are doing our bit to also provide awareness to people through our blog. We have articles on the blog about the ongoing pandemic. We also have the platform where people can come up and log on to chat with specialists and doctors who would adequately respond to all of their questions concerning the COVID-19 pandemic. So when it comes to awareness, I think there are adequate materials available online that people can access to understand exactly the cause of the disease and the precautionary measures they can take to protect themselves and their families from contracting this virus.
From the discussions your doctors have with persons who log on to the website, especially to talk to them about several issues. Talk to us from that window. What is the most recurring issue people are, talking about with regards to the pandemic?
So from our experience, when people log online, most times they just want to access information basically on what they're supposed to do and how they can protect themselves. And then some people also come online with some symptoms, like people are really worried because of most of the symptoms that for this virus are very common symptoms like cough, sneezing, catarrh. So they come online to ask about their symptoms and if the symptoms mean that they have the virus. So we tend to always help with explaining to them their symptoms and explaining to them the cause of the disease and the reasons why they might not be at risk of being positive to the COVID-19 virus.
All right. A lot of people have talked about the issue of panic and anxiety and fear. How much of that do you see when you engage with people?
Okay, so right now we cannot, in the world with this ongoing pandemic, there's a lot of panic with the numbers that we see, the constant rise in the numbers of people infected and the number of deaths occurring from this pandemic. A lot of people are scared and panicked, and we see a lot of that when people come online to talk to us. So a lot of people that normally have symptoms of cough, sneezing, without any history of travel history or exposure history, are worried because they have cough or catarrh. So with the ongoing COVID-19 pandemic, we've seen a lot of people come on the platform with only symptoms of cough, and I ask them if they have travel exposure history, and the answer is no. Any other symptoms, no. And yet they are scared that they might have contracted the virus. So with this ongoing pandemic here, there's a high level of panic among people. But if people take caution and follow the precautionary measures that have been put in place, I feel like we can help reduce the spread and hopefully with adequate information, control panic.
All right. Thank you very much, Dr. Okeke Awele, for your enlightenment on the program. Thank you.
Well, joining us via Skype to discuss the rising cases of coronavirus is Dr. Okeke Awele, Program Officer, Onkopadi COVID-19 Response Unit. Thank you for joining us. Now, from what you have seen and so far across the world, would you say that governments are responding alongside the level of spike being seen with the cases being recorded with regards to the pandemic?
Good morning. It's nice to be here. Yes, I believe that the government, all governments around the world are responding adequately to the spikes that we're seeing in concerning the COVID-19 pandemic. A lot of governments right now are putting in place measures to restrict movement, ensure that social distancing is adhered to by the citizens of the state. Even Nigeria is not left out, as President as yesterday put Lagos and the FCT on a 2 weeks ban, restricted movement. So I believe that the governments of the world are adequately responding to the COVID-19 pandemic by putting in place adequate measures to help restrict movement and ensure that their citizens adhere to social distancing and practice the self-isolation measures.
Now, how do you think that this pandemic or the coronavirus is going to impact or change our lifestyles or the way we do things going forward?
So I believe this would actually affect day-to-day activities of individuals greatly, because right now a lot of individuals have to adapt to staying indoors for 24 hours and more at a stretch. We would have to we would have to use other tools to stay in touch with family, get work done. Would have to move from physical meetings or physical appearance to digital space, which is going to more like affect the way we do things on a day-to-day basis. That nowadays people will have to learn how to do things more digitally, using online platforms to get across messages, get work done, get consults out, and that's where Uncle Paddy comes in. Because now we are using like telemedicine to make sure that people get information that they need and are able to get the care they need even in the midst of this pandemic.
All right, Dr. Okeke Awele, thank you so much for speaking with us.
Right, joining us via Skype is Dr. Okeke Awele, the Program Officer on Kopadi COVID-19 Response Unit. It's good to have you join us right now, Dr. Awele. As it is right now, many countries of the world are doing everything they can to ensure that they stop the spread of the virus. And one of the most potent weapons that has been put forward is the issue of staying at home and ensuring that people don't go out. Now, others are saying that the fundamental information of what people should know is not on ground yet. What do you make of how aware people are about this pandemic?
Okay, good morning, everybody. It's good to be here. Right now, I feel that in the presence of this pandemic and the fact that we have been asked to stay at home, and I believe that there are available, or there are a lot of available information online for people to adequately access, to adequately understand what is going on. And also, if people just take out the time to go online to verifiable links and website, they can have access to adequate information that they need. That is where Uncle Paddy as a tool is coming in to help people to help provide this information to people. So if anyone out there has any questions or just need any help on this COVID-19 pandemic, they can go on our website and access information through our chat platform and our blogs at www.unclepaddy.com. We are available to give them all of the information they might need during this COVID-19 pandemic.
All right, some countries are saying that they are challenged when it comes to increasing the capacity to test persons across the countries, and that seems to be a major issue. How much of a challenge does this pose to tackling this pandemic, as much as people are told to stay at home and self-isolate?
The challenge to getting tested. Right now, the world is trying to reduce the spread of the virus. So that's why we've been asked to stay at home to help flatten the curve and limit, or to help control the spread from persons to person. So even though most nations of the world are presently taxed with the tax or have difficulty getting their citizens tested. But if we adhere to the precautionary measures that have been put in place for us to stay at home and social distance, avoid gatherings in public places, we can help flatten the curve and reduce the spread from person to person, and hopefully curb the COVID-19 spread in due time.
Now, what do you think is responsible for the spike in the numbers, despite the fact that most of the countries hardly hit are on lockdown, but the numbers keep rising? What do you think is responsible for this?
So if I'm to propose a theory, I would say it's a possibility that before these measures were put in place in some of these countries that are now on lockdown, it's possible that people were already exposed to this virus, and especially if they were not showing symptoms at the point where they came in contact with other people. So this might be a reason for us to see the rise in the numbers. So these people that were exposed before measures were put in place, where extreme measures were put in place, like stay at home, social distance were put in place, these people are now just coming down with the disease. And we might still see a rise in the trend of disease for a few more weeks before we start seeing a decline. Because now that measures have been put in place, and now we are reducing people's contact to other people, thereby stopping the spread, person-to-person spread. We might see a rise for a few more weeks, but now with the measures in place, hopefully in the next few weeks, this rise would start declining.
All right, share with us your experience as the program officer for ONCOPADI. What has been the most challenging thing so far that has been experienced by your organization while trying to work during this pandemic?
Okay, so ONCOPADI has been trying to help flatten the curve by providing information, helping to triage patients. Through this COVID-19 pandemic. So helping the worried world that come on our platform to ask questions, people that have symptoms. We're also helping to counsel and monitor and follow up our patients that we had prior to this COVID-19 pandemic, those are the cancer patients, because of now they will have limited access to the facilities, tertiary facilities that they usually visit. So our major challenges right now would be people coming online with excess of information and being worried, basically. The major challenge we are faced is helping allay fears of people. People come online with a lot of fears and like a lot of information, bombarded with information. So we're just basically trying to help navigate and allay people's fear during this COVID-19 pandemic.
All right, thank you very much, Dr. Okeke Awele, for your time with us on TVC Breakfast.